I'm going to show you how improving your gut health is so important in raising your low ferritin levels so that you can feel better. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And I've been blessed to have seen over 100,000 patient visits in the last 38 years, many of whom have gut and thyroid issues. And I typically see either high or low ferritin levels. And this patient was no exception in that she came in with symptoms of gas, bloating, constipation, indigestion, fatigue, brain fog, insomnia, anxiety, hair loss, overweight. She had an enlarged thyroid with multiple nodules and had hyperparathyroidism. We ran lab testing and it revealed that she had low ferritin. She was at a 10. So lab ranges are typically 10 to 150 or 10 to 400 in men, depending on the lab. And her level was 10. She was not anemic. And that's the thing. When you get your blood testing, doctors rarely check ferritin. So you want to make sure you get an iron panel with ferritin because all these years, her regular blood test showed that she was not anemic. Her hemoglobin was fine. So no one ever thought that she had an issue. However, you want optimal levels of ferritin to be 50 to 80, depending on other factors. And she was only 10. So that can cause a lot of the same symptoms of anemia that she was experiencing, like the fatigue, brain fog, anxiety, hair loss. She also had high glucose. She was pre-diabetic, insulin resistance, adrenal dysfunction, high parathyroid hormone, and high inflammation. So in finding out underlying root causes, we did functional testing that checked for deficiencies. She was low in vitamin D, folate, other B vitamins, CoQ10. So that's the thing. When you're deficient in iron, have low ferritin, and typically you have other deficiencies as well. In checking for gut infections, she had candida yeast and bacterial overgrowth. Under food reactions, she had celiac genetics with gluten sensitivity and leaky gut and other food reactions. And under hormonal imbalance, she had adrenal dysfunction. And that is one of the most common causes of low iron or low ferritin that I see is gut malabsorption, typically caused by food reactions, most commonly gluten and infections, most commonly bacterial and yeast overgrowth, and sometimes H. pylori and parasites. So I put her on a specific diet and supplements, which I'll review in a minute. But the outcome was at 7 weeks when I retested her blood, her ferritin went from 10 to 66. That was over a 500% increase. And the following blood markers improved. Her glucose went down 20 points to normal, improvements in her insulin, white blood count, hemoglobin, hematocrit, DHEA, and her parathyroid hormone dropped 121 points to normal levels for the first time in years. She was losing inches, which she was happy about, and her hair loss had improved substantially. So how she made such improvement in 7 weeks was, number one is an anti-inflammatory diet I call the Free Diet. It's a diet I came up with years ago when I was figuring out how to heal my own Hashimoto's autoimmune thyroid condition, rheumatoid arthritis, IBS, fatigue, skin issues that I was dealing with. And I developed this diet and was able to get better. And since then, helped many others. I call it the Free Diet because it's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. And if you'd like a copy of the Free Diet Phase 1 food chart, I'll put a link below for you. And the second step were supplements. I gave her what I call the Functional 5, which is multi-fish oil, vitamin D with K, magnesium, and probiotic. And then the specific iron I use is iron glycinate. I gave her 4 a day. That's almost 120 milligrams, along with vitamin C and gut support supplements, adrenal support, B complex, iodine, and other nutrients that she was deficient in. And that's how she was able to raise her ferritin from 10 to 66 in 7 weeks. She also said her thyroid was significantly less swollen. She had more energy, gut symptoms better. So she was just feeling a whole lot better. So if you have low ferritin and these other chronic health issues, if you first get to the root causes and are provided the right solutions, I believe almost anyone can get better. So thanks for joining me today. I'll put a video that goes into the Free Diet in more detail here and a link to the Free Diet food chart below. Feel free to like and subscribe, and I look forward to seeing you next time.